We are going to talk about ADHD regarding its pathophysiology and symptoms as well as treatment. What is ADHD? It is attention deficit hyperactivity disorder where boys are diagnosed at more than double the rate girls are. It is a neurobiological disorder affecting the processing of information in the brain, which may be due to heredity or neurobiological disorder caused by neurotransmission imbalances or due to environmental influences. Weak dopamine signals suggests that activities provide fewer rewards to these children and low arousal in the CNS. So to compensate, children with ADHD seek out stimulation to increase arousal. ADHD affects 3 to 5% of the school-age population, where children diagnosed with the disorder are often exhausting to parents and teachers, and even their peers find them difficult to deal with. Although ADHD is often diagnosed and said to occur in children more frequently, adults also have the tendency to suffer from the disorder. The disorder is marked by inattention and decreased tolerance for frustration and generally a great deal of inappropriate activities, as well as impulsiveness. ADHD is classified to 3 subtypes according to the symptoms: predominantly inattentive type and predominantly hyperactive impulsive type, as well as combined type. Children with ADHD are more likely to have major injuries and to receive outpatient care, and to be hospitalized, and to be seen in an emergency room.
My ADHD is so bad that I have to close my eyes when I'm on the phone. I won't pay attention to the person otherwise. Literally everything in front of me is a distraction.
I hate having ADHD. It's like my mind is running in 10 different directions.
I think the main reason I've never dated is because of my ADHD. I can't sit still for more than 10 seconds.
I have ADHD, and nobody knows because I don't want it to be an excuse.
I just started college. My ADHD is awful. I think I'm going to fail.
I really want to join the military, but I don't think I can make it without my ADHD medication.
For the first time in my life, I'm taking meds to help regulate my ADHD. It's helping, but I don't like how my personality is different.
I have ADHD and can never pay attention, and it's kind of putting my friends and family on edge.
I wish I could turn my ADHD off. I've had to read whole chapters over again and restart movies because I was thinking about something else.
I joke with people about having ADHD when I act dumb, but I secretly do have it, and it makes my life a living hell.
In most cases, ADHD is best treated with a combination of medication and combination therapy, where combined therapy may be psychoeducation by encouraging parents for their child to discuss ADHD and how it affects them. Social skills training, which aims to teach them how to behave in social situations and learning how their behavior affects others. Parent training and education programs. Cause parental education and support are important parts of treatment. Cognitive behavioral therapy, where we create a routine and try to follow it every day and avoid distractions, especially when your child is doing homework, and limit choices between 2 things and be organized by putting things in the same place every day, and simplify by using brief directions to remind your child of responsibilities. Medications. They help in improving attention, alleviating many of the behavioral problems associated with this syndrome, reducing hyperkinesia. Lisdexamfetamine, the prodrug that is converted to dextroamphetamine after GI absorption and metabolism. Atomoxetine, a non-stimulant drug approved for ADHD in children and adults, cause inhibition of NE reuptake. Not considered habit-forming. Methylphenidate, the CNS stimulant available as extended oral formulations. The transdermal patch for one's daily application. DA and ANE transport inhibitor and may act by increasing both DA and ANE in the synaptic space. A Schedule II drug. However, it is one of the most prescribed medications in children, as 4 to 6 million in U.S. use it daily, and its isomer, dexmethylphenidate, also a Schedule II drug used for treatment of ADHD. Adverse effects. Gastrointestinal adverse effects as abdominal pain, nausea, insomnia, anorexia, nervousness, fever. Contraindications. In seizure patients, may increase seizure frequency, especially if taking antidepressants. And in glaucoma, and can inhibit the metabolism of warfarin, phenytoin, phenobarbital and tcapyrimidine. It is interesting to know that people with ADHD are 300% more likely to start their own company. ADHD is not caused by eating too much sugar, watching too much TV, poor parenting, or a chaotic family environment. Famous people who overcome ADHD: Justin Timberlake, celebrity Keith James Oliver, Will Smith, Olympic champion Michael Phelps, Jim Carrey, Richard Branson, Paris Hilton, Howie Mondale, Terry Bradshaw, Michelle Rodriguez.